Researchers studying Alzheimer's disease find concrete evidence that regular exercise, a healthy diet, and mental stimulation can prevent or at least delay the onset of the disease. Joining us now is Dr. Thomas Obishisan, who specializes in geriatric care at Howard University Hospital. Doctor, thank you for joining us today. I have to admit, I'm one of these people who gets it wrong all the time. I confuse dementia and Alzheimer's, so please set me straight.
Well, that's not really unusual. Dementia is the family name for all types of dementia, and Alzheimer's disease is a type of dementia.
Okay,
yeah.
All right. So let's specifically talk about the differences between an Alzheimer's dementia that sets in versus some other type of dementia.
Well, we know for a fact that Alzheimer's disease is the most common type of dementia. There are other types such as vascular dementia, Lewy body dementia, other disease entities such as normal pressure hydrocephalus, frontotemporal dementia, or other types of dementia.
And so how do those types of dementia differentiate themselves from Alzheimer's? Because I know Alzheimer's can be very quickly progressing.
Well, there are two types of Alzheimer's disease. There's early onset and the late onset. I think the one that you alluded to that progresses very quickly is the early onset.
And that's when you're in between 40 and 50 years old?
Yes. The late onset tends to creep on people very slowly, and then slowly progressive over time. Over the past decade or so, I think we've become more aware of some important changes that goes on in the brain that helps us to really identify individuals who have Alzheimer's disease.
And I understand Alzheimer's accounts for 60 to 80% of dementia cases, so it is the majority of dementia cases.
That's correct.
And we talked about the fact that diet and exercise and mental state of mind can help with respect to whether you're going to get Alzheimer's. Again, this is not genetic based, is it?
Well, yes and no. Over the past decade or so, we began to realize that there may be some overlap between cardiovascular disease risk factors between cardiovascular disease risk and Alzheimer's disease risk. And the question that many of us began to ask at the time was, okay, if cardiovascular disease risk promotes or catalyze the development of Alzheimer's disease, can the same lifestyle intervention that we know work for cardiovascular disease can work for Alzheimer's disease? I think that sparked a whole range of scientific investigations looking at dietary habits, looking at the contribution of cholesterol, diabetes, overweight and obesity, hypertension, and then stepping back to ask the question, if we treat all these things, because we know for a fact that exercise can, in fact, mitigate against many of these risk factors. Since exercise has been demonstrated to reduce this risk for cardiovascular disease, can it also be beneficial for reducing Alzheimer's disease risk?
And do you think so, doctor? I mean, what do you think? What are you seeing in your patients?
Well, the available evidence suggests that yes, indeed, it could be beneficial. We started primarily from cross-sectional studies to epidemiologic longitudinal studies, and now we're at the point where we're actually conducting randomized controlled trial. For example, a study that was discussed at the last AAIC meeting, Alzheimer's Association meeting in Copenhagen, does show that yes, if you combine all these things like using a multimodal approach, including exercise, dietary control, social engagement, the enrichment of cognitive processes, that is cognitive training, all these things combined together can in fact enhance memory processes. In our own study here at our university, we are not only interested in finding out whether or not exercise can improve memory processes. We're also interested in finding out by what mechanism does exercise improve memory processes. That brings me to the issue of genetics that you raised earlier on. For several decades, I think the idea of gene-environment interaction has been tossed around quite a bit. And through some of the work that we recently did, in fact, presented that abstract in Boston last year, we were able to show that, yes, indeed, exercise actually interacts with the genes to function differently. And that may actually explain some of the ways by which exercise enhances memory, in addition to reducing cardiovascular disease risk.
Well, that's another good reason to get out there, get off your duff, and get some exercise, right, doctor?
Correct.
Well, you know, I have to say, I've got an uncle whom I love so dearly, and we always used to just have a ball talking politics and just talking, and he doesn't recognize me anymore, and my heart's broken. But it's good to know that we are moving in the right direction of getting some answers of what can be helpful. Any new medications out there, or any medications that can be helpful?
Well, as it stands today, the medications like Aricept, Namenda, and those group of medication is what is currently approved by the FDA. But we are in very hot pursuit of finding a treatment that works better for Alzheimer's disease. In fact, we're at the planning stages, actually about to begin a study called the A4 study, which is actually going after the abnormal protein that has been identified in the brain of persons with Alzheimer's disease. What we have been doing before was actually treating the symptoms of the disease.
Gotcha.
Now we're actually going after the cause of the disease.
Dr. Thomas Obashusan, thank you so much for joining us from Howard University to talk to us about Alzheimer's and some good stuff on the horizon. Keep exercising, keep moving, keep your brain active. Thank you, doctor.
It's my pleasure and privilege.
How an Atlanta entrepreneur wraps up fashion and design in a neat little package. That's next.